Hi, this is Dr. Michael Timms, and I wanted to give a quick introduction to both the idea of idiosyncratic toxicity and use Kava as a case study for that. Everyone here, I'm sure, is familiar with Kava, Pipermethysticum, Awa, Kava Kava, Q, Tonga. It's well known in the field. And the idea of intrinsic versus idiosyncratic, intrinsic being that there is a chemical property to the phytochemicals in the plant that are responsible, or that you can see a dosing level associated with the toxicity. The toxicity can be recreated in animal studies to provide mechanistic explanations, and that it's reproducible. And generally, the idiosyncratic toxicities tend to be a complex interaction between both genetic and non-genetic factors, what we call confounding factors. And that'll come out and be a little bit more clear as we go through a discussion on Kava. So Kava, I'm sure, are aware it's a Polynesian or Oceania-based plant, and it's the root and the rhizome. And this is a cultivated plant. It's sterile at this point. There's no longer any sexual reproduction. And pre-contact Hawaiians had about 14 cultivars that they used. And since that time now, we're up to about 20 cultivars. And I think this will be important later on, and I'll come back to that idea. In those cultivars, they looked at, one study looked at 63 accessions being samples of those cultivars. And they found 16 different morphotypes. These are plants that have a certain morphological characteristic, but only one genotype. And so they believe that the morphological variations are due to somatic mutations in a few genes that alter what they look like. They did identify a number of chemotypes, but they can't necessarily associate those with or correlate them with a particular morphotype. Again, I think what's important here is that given all these cultivars, that there are some underlying differences, particularly in the phytochemical profiles. And we'll see how that can be play into some of the issues that came into play with Kava. And so the question for you is, why are we worrying that Kava is toxic? Right? If it's toxic, let's just stop using it. And we haven't decided it's toxic, but let's just pretend. So really, it's because Kava is a wonderful plant. A very nice Cochrane meta-analysis by Pittler and Ernst showed that it was very good for the treatment of anxiety. And they looked at it with placebos. It was also done with current treatments in the anxiety arena, and that it was very effective for symptomatic treatment option for anxiety. Very low adverse events in these trials, very mild, transient, and infrequent, although they suggested a short-term use of 1 to 24 weeks. This wasn't necessarily based on any data or any of the findings in the trial, but this was really more based on what was being used contemporarily in Western Europe at the time. It's also very useful for sleep disturbances, and we're seeing statistically significant improvement in sleep quality, and that we saw the effects in terms of the HAMA, psychic anxiety subscores, that particularly sleep disturbances associated with depressive symptoms or anxiety symptoms. So again, this is really a wonderful drug. Herb, and we want to continue to use it. So some adverse events that began to appear. There was a study by Stevenson et al. These are post-market surveillance studies of about 7,000 individuals. And the range in the dosing was about 105 to 120 milligrams of cavalactones a day. And the adverse events that they saw were very rare. They were very mild, very reversible. So these are things that, like allergic reactions, gastrointestinal upset, headaches, sometimes a little dizziness. But there had been case studies appearing that begin to show that there are dermatological reactions, some neurological complications, and in particular liver damage. And when these case studies began to appear, particularly in Germany, they stopped the sale of Kava in the marketplace. And since then, they've gone through, and some of what we'll discuss is what came out of these studies and hearings, that really they're now allowing Kava back, and they're looking at it really more as idiosyncratic rather than an inherent toxicity. There was some work done on long-term safety, which I think was kind of important. And what I want you to pay attention to here particularly is the difference in dosing. This was in Arnhem Land, indigenous Australia, 340 people, average use of about 12 years. So much, much longer than the 1 to 24 weeks. And they had, if you look at the 12.5 grams of cavalactones a week, even if we broke that up, you're talking about just less than 2 grams a day. When the previous study, you were looking at, and that's cavalactones, by the way, you're looking at a much higher dose. We're looking at 118 grams of root powder per week. So the most frequent adverse event was a characteristic dermopathy. These are sort of scaly growths on the skin. And that there were increases in both serum GGT of Kava users. This is a liver enzyme that signifies that something's happening in the liver. It's working hard. There's some tissue damage potentially. And all of this returned to normal within a day after discontinuation, when there was no alcohol involved. They did not look at the interaction with alcohol or other substances, anything that might have been hard on the liver. So they were looking at folks that weren't concomitant users of alcohol, or particularly addicts of any kind. And the case studies, though, does point out something, that there are some elements in the chemical structure of cavalactones that suggest a reactive metabolite. And we'll take a look at that in a minute. But the skin rash is pretty consistent with reactive metabolites that are covalently binding to skin proteins and stimulating an immune-mediated response. But to date, there had been no indisputable rationale for increased prevalence of Kava-induced hepatotoxicity in the West. So let's just take a look at this structure. These are Kava pyrones. That's methysticin. And there's a series of them. These are under the class of phenols, and then a subclass flavonoids, and then Kava pyrones. That's the metabolic pathway structure relationship. And if you look at this, particularly the way the oxygen bonds, there are several that have either ketone structure or aldehyde structure. These are reactive metabolites, and you can look at that and say this is going to be biologically reactive. Now, whether that means it's inherently toxic to the liver, is really up for some debate. So the question is, what's going on here? I mean, we mentioned that the German Commission E was talking about 120 milligrams of cavalactones a day for 3 months or less. That's 840 milligrams a week of cavalactones. In the Arnhem Land study, you're looking at 12.5 grams per week for 12 years of daily use. So the measurement of the cavalactones in the Arnhem study was somewhat of an estimation, saying that we expect a certain percentage of cavalactones per gram of plant material. But some of the things that have happened, let's go back to that cultivar issue, is the traditional noble cultivar, which is used in a lot of Polynesian cultures, has a different phytochemical makeup than what's referred to as Tude. And so we're looking at an increase in the total cavalactones, but also a change in the ratio of those cavalactones. We're also seeing what in some instances really could be referred to as a form of economic adulterations. Usually the root and the rhizome are used, but you're beginning to see stalk peelings being thrown in. They have a similar organoleptic signature. Once they're cut up fine enough, they look similar. But again, they're going to have a very different makeup of the cavalactones, and actually introduce some other compounds, such as some alkaloids, that we don't see in very high ratios in the roots and the rhizome. And then finally, extraction processes. The traditional aqueous extraction of kava yields usually around 30% kava lactones. If we go back to that structure, that even though you do have a lot of oxygens, which are highly polar, it's the resonance structure, what we would refer to, all the double bonds that allow that polarity to be shared across the whole molecule so that you don't get the kind of characteristic polar nature of one side of the molecule holding all the electrons versus the other. So we get more lipophilic based extraction. That's why if you get a good ethanol based extraction of kava lactones in a tincture and you drop it into water and you get that white opaque look to the water, you're actually getting kava lactones precipitating out of a less polar extraction solvent, the water ethanol mixture, going straight into aqueous structures. So even though the traditional aqueous extraction is water-based, the lactones aren't nearly as soluble in that method. So when we started to go to organic methods, using higher alcohol, but also looking at, you can see this out in the market, supercritical fluid extractions with CO2, you're really changing the product fairly strenuously. The final piece of evidence really that suggests it may have some intrinsic elements on a sheer phytochemical structure basis, but really the overwhelming evidence is idiosyncratic, is genetics. The phytochrome CYP2D6, which is involved in the metabolism of these kava lactones. There's about a 10% deficiency in those enzymes in European populations as opposed to the Polynesian populations. So if it was going to pop up as an issue, it was probably going to be evident in populations where that deficiency would make it much more evident. So I think this makes for a very interesting story about how our contemporary thinking on traditional medicine may not always be correct. So I think this is the kind of conversation between tradition and evidence-based that's really makes us better herbalists. So I want to thank you and enjoy the class.